Hello everyone. Welcome to the second episode of Know Your Tools. In the previous video, we spoke about gloves. If you haven't watched it yet, click on the link below. This video, we are talking about diagnostic instruments. Diagnosis is the identification of the nature of the problem by examination of the symptoms. When a patient comes to you with a dental problem, you need a set of basic instruments to check and evaluate the various parameters and then, if required, advise further investigations before finally coming up with a diagnosis. These instruments that aid in diagnosis are called as diagnostic instruments. So now when we are talking about instruments, there are certain terminologies to be known. A typical instrument has three parts: the working end, shank, and the handle. The handle is what is used to grasp or hold the instrument. It can be solid or hollow. Hollow handles are used more often because they have a better tactile sensation and it reduces muscle fatigue. Solid handles, on the other hand, have a reduced tactile sensation and it increases the muscle fatigue. Sometimes the handles may be serrated or smooth. The serrations help in better grip and it allows better control of the instrument. If the handle is smooth, the chances of instrument slippage are more. The shank. The shank connects the handle to the working end. It allows for easier adaptation of the working end to the tooth surface. It can be functional or terminal. The functional shank extends from the working end to the shank bend closest to the instrument handle, whereas the terminal shank extends between the blade and the first bend. Long functional shank is used for posterior surfaces, whereas the instruments with a short functional shank, they are used for anterior teeth. Next comes the working end. The working end does the work part. It has a face, cutting edge, and a tip. Now, if the tip is pointed, it is called as a tip, and if it is rounded, it is called as a toe. There are a total of 4 diagnostic instruments: mouth mirror, explorer, probe, and the tweezer. We will be looking at each of these instruments next. This here is the mouth mirror. It is also known as stomatoscope. If you break down this word, stomato means the mouth, whereas scope is a suffix denoting an instrument used for observing. So as the name suggests, a stomatoscope or a mouth mirror is used to view the mouth. It has a handle and a rounded mirror. Now, based on the material, the handle may be stainless steel, which can be autoclaved, or it can be plastic, which is disposable. The round mirror may be angulated or straight. Now, based on the reflecting surface, there are 4 types of mirrors: the flat or the plane reflecting surface, concave mirrors, front surface, or the double-sided mirrors. Flat mirrors, these have reflecting surfaces on the back of the mirror. So this causes a problem of ghost image. So a clear image is not seen during indirect vision. Concave mirrors magnifies the image which is formed. So it is not recommended for routine use. Front surface mirrors, here the reflecting surface is on the front side. We also have double-sided mirrors, wherein one side retracts the tongue or the cheek and the other side can be used to view the image. Depending on the size, there are total 5 types. Number 1 is 16 mm, that is the diameter of the head. Number 2 is 18 mm, number 3 20, number 4 22 mm, and number 5 24 mm. Out of these, the number 4 and number 5 are the ones which are most commonly used. We also have handles which have serrations. Now these serrations improve grip. A mirror is used for indirect vision, illumination, retraction or protection of the soft tissues, percussion of teeth, and also for checking tooth mobility. There are some hurdles which may come when you are using a mouth mirror. There may be fogging of the mirror. So what? Either use a cotton to wipe the fog or spray a layer of water over the mirror prior to the start of treatment. There is also a self-cleaning dental mirror available, that is the Eero self-cleaning mouth mirror system. Explorer. It detects by tactile sensation the texture of the tooth surface. So it is used to check for pits and fissures, carious lesions, smoothness of the root surface, smoothness of the margins of the restorations. It has a sharp pointed end which is called as the tip. Now it can be single-ended or double-ended. One of the most commonly used explorers is the number 23 or shepherd's hook explorer. It gets this name as it resembles the long stick with a curved end that the ancient shepherds would carry to catch sheep. This is used supragingivally to detect occlusal caries and examine the margins of restoration. We also have the auburn type or number 17 explorer, where the tip is bent 90 degrees to the shank. This allows the back of the tip to be used subgingivally. You can easily insert it into the narrow pockets with only slight stretching of the tissue away from the root surface. One point to remember here is that for the detection of dental calculus, you use the side of the explorer tip and not the actual tip. Other types of explorers include the pigtail or the cowhorn explorer, number 11 by 12 type explorer, and the straight explorer. Probe. The main function of a periodontal probe is to determine the health status of the periodontium. As per B.J. Auburn, it is the eye of the clinician beneath the gingival margin. This one here is the Williams periodontal probe. It is the prototype from which subsequent probes were designed. It has markings at 1, 2, 3, 5, 7, 9 and 10. 4 and 6 are missing to avoid confusion. This is a Goldman-Fox probe. It is similar to the Williams probe, but it has a flat working end. There are various other types of probes available. Here we have the CPITN probe. It has markings at 3.5, 5.5, 8.5 and 11.5 with a 0.5 mm ball at the end. There is color coding present between 3.5 to 5.5 and 8.5 to 11.5. The ball end goes easy on the gingival connective tissue, and so this probe is used for the screening purpose. Then we have the UNC 15 probe. It has markings from 1 to 15 with color coding at 5, 10 and 15. Neighbor's probe. It is curved and it is used in detection of the horizontal component of the furcation involvement in multi-rooted teeth. It is double-ended, it has curved working end and a blunt tip. We also have plastic probe which is used for implants. The implant probes can be plastic or non-metallic type. The main aim is to ensure that there is no damage to the abutment surface. Now these probes, they are used for measuring the clinical attachment level. That is then we also check the probing depth, the extent of recession from gingival margin, width of attached gingiva, whether there is bleeding on probing. It is also used to measure the size of intraoral lesions and determine mucogingival relationships. And lastly, we have the tweezer. It is also known as college tweezers. They carry materials into and from the mouth. They have a straight or a curved working end, and there is also a lock type tweezer available to ensure that the material does not drop. In all, these are the 4 instruments, that is the mouth mirror, explorer, probe and tweezer, which are used as diagnostic instruments. Hope you guys found it useful. Thank you for watching.